Hi, my name's Alicia, and I'm here today to talk to you about anticoagulation therapy after hip surgery. Each year, approximately 200,000 Americans undergo a total hip surgery. Statistics reveal that between 400 and 800 people develop a fatal pulmonary embolism in the first 3 months following this procedure. A pulmonary embolism is a blood clot which forms in a leg vein, breaks off, and travels to the lungs. Another complication experienced by some total hip replacement patients is localized swelling and pain in the affected area, which a clot forms and causes decreased flow of blood to the heart. These complications occur more often following hip surgery than any other type of surgery. Today we're going to look at Lovenox. Lovenox is sent home with most patients following a hip surgery due to the fact that they can take this treatment at home without having to do blood tests. By continuing your treatment at home with Lovenox, you're taking the important step in helping to reduce the risk of developing a DVT blood clot or a deep vein thrombosis. Throughout the kit, you'll learn how to give yourself the Lovenox shot. When you have your Lovenox prescription filled, you will receive a pre-filled Lovenox syringes that look like this, that are ready to be used. You should continue treatments with Lovenox as your doctor has prescribed and follow through with all your medication as directed. After all, staying involved in your own healthcare is an important part of your recovery. So when we look at a blood clot forms, it can break off and travel to your lungs. Over 200 million Americans suffer from a DVT. The increased risks of DVT is the number one, hip replacement surgery or clotting disorders, prolonged immobility. So most of the time in the hospital, we usually see our patients going home with the Lovenox shot due to the prolonged immobility. Many signs of the DVT or PE are pain and tenderness in the leg, swelling, warmth on the leg, chest pain, rapid pulse, rapid breathing, shortness of breath, a cough, any type of fatigue. In clinical trials, Lovenox has been shown to be 99% effective in protecting hospitalized patients from pulmonary embolisms and potentially fatal complications of a DVT or blood clot. Over 130 million people worldwide have been prescribed Lovenox. You should always follow your doctor's specific instructions of how long to continue your Lovenox treatments after you leave the hospital and how you should inject Lovenox. When we look at the injection site of Lovenox, we want to look at an orange today. You always want to wash and dry your hands thoroughly before injecting the Lovenox shot. You want to sit and lie in a comfortable position, whichever is more comfortable to you or where you feel more comfortable giving the shot. You want to choose an area on the left or right side of the abdomen, at least 2 inches from your belly button, and we're going to pretend that this is the belly button, and we're going to go 2 inches, either left or right, and you can always think love handles. You want to clean the injection site with an alcohol swab that also come in your kit. So today we're going to do the right side. So we want to alcohol that site, and you always want to let it dry completely. So as you have your needle, you always want to remove the cap by pulling it straight off the syringe and always discard it in your sharps container that also comes in your Lovenox box. You want to hold the syringe like a pencil in your writing hand. With the other hand, you want to pinch an inch of the cleansed area, insert a full-length needle straight down into the side at a 90-degree angle into the fold of skin. You want to press the plunger with your thumb until the syringe is empty. You want to pull the needle straight out at the same time that it was inserted and release the skin fold. You always want to put the needle down so you don't end up poking yourself or someone else. And you obviously just press down and it'll automatically click and also keep you from safety. And you also want to discard that in your sharps container. So next we want to look at the do's and the don'ts of the Lovenox. You always want to let the injection site dry after applying the alcohol. A wet site can cause increased stinging. Do be sure to hold the fold of skin of your abdomen until you're finished giving the injection site to ensure that the medication enters in the only fatty tissue, not the muscle. Do alternate injection sites each time you're giving them, and do inject the same time every day. Do dispose of the syringe in the sharp container. Do look for unusual signs of bleeding. Do tell your doctor about any other medications that you may be taking, including those that do not require a prescription. Now for the don'ts, don't put the syringe down or allow anyone to touch or anything after taking off the needle cap. You want to keep it sterile. Don't twist the needle cap off. It could bend the needle. Don't inject into an area where it's scarred or bruised, or anywhere where the clotting may rub. Don't rub the site after the injection, which could cause bruising. Don't recap the needle after an injection. The protective shield will be in place at this time. Don't freeze Lovenox. Always keep it room temperature. Don't give Lovenox to anyone other than the person it was prescribed for. Don't take these common medications while you're taking Lovenox, and that would include aspirin, any other platelet inhibitors, non-steroidal inflammatory drugs known as NSAIDs, cold or allergy products. Lovenox, like all medications, may have side effects. The most common side effects include mild local reactions or irritation, pain, bruising, and redness at the skin. You should always contact your doctor if you notice bleeding or oozing from the site. Any other bleeding episodes, for example, bleeding at the site of the injection, nosebleeds, blood in your urine, or if you vomit any blood. Spontaneous bruising, pain or swelling in any part of your leg or foot, dizziness, numbness, or tingling, rapid or unusual heartbeat, chest pain or shortness of breath, vomiting, nausea, or fever, and confusion. These are just some of the side effects that you need to watch for. And that was just a brief demonstration on how you can go home with Lovenox as a hospitalized patient after a knee or hip surgery.